Good morning, everyone. My name is Dr. David Dyjack. I'm Chief Executive Officer of the United States National Environmental Health Association, and I'd like to share a few thoughts with you this morning on microplastics and the role of environmental public health professionals in this emerging issue. My favorite metaphor for examining practice in the year 2025 is one that I'll refer to as an isthmus. An isthmus is simply a piece of land that connects other two pieces of land. And for purposes of this talk this morning, I believe it's a bridge that represents change from the past to the future. On the past is how we've traditionally worked in environmental public health as compliance officers, as professionals who look at regulations and enforce them. In the United States, this often exhibits itself as the Clean Water Act or the Clean Air Act, the Toxic Substance Control Act, and the Food, Drug, and Cosmetics Act, among others. In other words, there are clear lines in the sand about what is safe and what is unsafe. As we move from left to right on the slide, you can see that I believe that we're now moving into an era not of compliance, but one of conformance, in which I include microplastics. What do I mean by conformance? Where there is no regulation to enforce, where professional judgment is important. Climate change is an example of that. Nutrition may be an example of that. Heat stress for public health may be an example of that. Wildfire smoke may be an example of that. And microplastics is also an example of that. There is no standard that I'm aware of for microplastics in food, in water, in soil, and so we need to use our judgment. Having said that, there are four things I believe the environmental public health profession can and should be doing at this time to help address this emerging environmental health issue. Number one, I believe we need to assist society in identifying high-risk populations. Those people that live adjacent to waterways, those that live on the seashore, and those that eat a lot of seafood which is often festooned with microplastics. I believe identifying those parts of the public that are at greatest risk would be of great assistance to the decision-making bodies of your country. Number two would be translating science into actionable insights. Let's face it, microplastics are complicated. There's oxidative stress, there's the gut biome, there's inflammation, there's endocrine disruptors. For a lot of people, they don't understand what all this means. And I think it's our role as public health scientists to explain to them why microplastics are important for us to be monitoring and addressing. Number three is to assist elected officials with developing new policies. We understand the science, we understand the exposure, we understand the root causes. I believe we need to be very effective at working with elected bodies to help develop policies that will reduce risk over time. And then finally, to take our role as risk communicators very seriously. We are trusted sources of information in our communities. Let us use that trust to advance conversations about microplastics and what we need to be doing about them moving forward into the future. So in summary, there are four things I think we should be doing right away, in addition to the basic science, and that is identifying high-risk populations, number one, translating science into useful information for the general public, number two, informing public policy, number three, and being a trusted source of information or quality risk communication, number four. I hope you have a great conference. It's wonderful to connect, and I hope to see you in person sometime soon.